Hello everyone, my name is Jerry, and today I want to talk to you about what to expect before and after an ICD implant or pacemaker. I'd like to start by saying hello. How are y'all doing today? I hope everyone's doing well. Well, if they wasn't, they probably wouldn't be on my website. I have an ICD implantable device made by St. Jude's. Top of the line. And how I come to get this device is a long story that we're going to cover after the comments about the device. As you can see, I do have one. Here it is. I'm not just one of them people on television that tell lies or tell stories about what they think. And I have had open heart surgery. Very bad one. What to expect? When you go to the doctor and the doctor tells you, hey, you got to have an implantable device to keep you alive, first thing you're going to do is get depressed and say, do I have to have it? Well, if you didn't have to have it, your doctor would not be wanting to put one in. Which, by the way, takes an electrocardiologist. That's who does it. First thing to expect, you go to the hospital, and when you go in the hospital, you get all your paperwork and all done, then you go back to the back, you sit and wait a little while, then they call you back and they put you in a little room. But when they put you in that little room in there, a nurse will come in there to talk to you. She'll come in there and she'll ask you all kinds of questions, and you'll answer those, and personal as well as medical information. And then she'll put an IV in your arm. After you lay in there for several minutes, or maybe even an hour, waiting on the electrocardiologist, the anesthesiologist to come in and see you. And they'll talk to you about multiple medical questions and surgeries that you've had in the past. Then they will walk out, and before they go, they will say the doctor will be with you shortly. Okay, right before you have to go back to surgery, there's going to be a nurse anesthetist come in there, and she's going to ask you the question, Mr. Smith or Mr. Davis, do you need something to take the edge off? Well, your answer better be yes. Take the little bit of drug to take the edge off, because you're going to need it. After she sticks that needle in your IV and plunges that little plunger down, you're going to start to feel mighty loopy, like a 3-day drunk. So at this point in time, you need to kiss and tell your loved ones goodbye, and that you'll see them when you see them. At this point, they roll you out of the room, they roll you down the hall, and they roll you into the operating room, where they transfer you from the bed that you was in onto the operating table, which is like laying on a concrete slab. It's very cold in there. Bear with them, because they have some work to do on you while you're waiting on the doctor. First off, a prep nurse will come in, and she will shave your chest. She will shave this whole area through here, even under your armpit. After they get you shaved, they will pour betadine on you, and they will scrub you with a scrub brush that feels like a wire brush, like you're trying to clean your barbecue grill with it. After they get you dried off, they will take a pliable piece of plastic, and it will stick over your skin. That is so that the doctor can make a clean incision without any contaminations getting into the wound or the incision site. They will make a hole, as you can see, about 4 to 5 inches long. They will then go in and place a catheter in through your collarbone, through a major artery all the way around and down into your heart. The first thing they will do is place the wires through your heart, or the electrodes, or the leads, or whatever they're called. And they corkscrew into the inside of your heart, whether it be the upper, the lower, or both chambers of your heart. Once they put the wires in, then they make the hole bigger and stretch it and laser it out in there to put your defibrillator in, or your pacemaker, or an ICD, which I have. Once they get it all hooked up, you'll be hooked up to all kind of monitors and everything, where they can test it out and make sure it's working properly. But I did leave off something about whenever they was prepping you. They'll put a tent over your face where you can't see anything. Put oxygen in your nose, and they put oxygen in your nose and put you over that tent right before they put you to sleep. But you will be asleep through the whole thing. I mean, you won't know nothing about it. But after they put it in, they test it, they fire it while you're asleep, and they check it out, and they regulate it and set it and make it like it's supposed to be, set it like it's supposed to be set. Once they get through with that, they'll send you back to recovery. And I'm going to tell y'all something. I had a Dr. Kirby from Cardiology and Associates. He practices over there at Spring Hill. You don't ever want that joker to work on you. He don't give you nothing for pain or nothing else after surgery. And I'm going to tell you what, it's going to be a painful thing when you wake up. This is a very painful procedure, not to have any type of pain medication. I'm very pain tolerant and I don't take pain medication, but I would have took it if I had it because I asked for it. And the nurse said the doctor didn't give any orders for pain medication. So you need to make that clear with them, with the doctor, that he's going to have to give you some type of pain medication for this procedure. They give you a numbing medicine like a dentist does when they're doing the work. But it wears off just like a dentist anesthetic wears off. It wears off in a few hours. And I'm going to tell you, it's very painful. My mom just had a pacemaker put in, and she's going through the same thing right now. After you get the pacemaker in and everything and get out of the hospital and they send you home, they're going to give you a special belt to wear with a sling on your arm to tie your arm down to your waist. And that you have to wear for 1 month. You can't turn over in the bed, you can't lay on your side, you have to lay on your back, and you have to wear the brace while you sleep or you'll tear all this stuff loose in here. And that's something you don't want to do because you'll bleed to death. After about a month, the sling will come off, but I'm going to tell you, this thing's going to hurt you, and it's going to be tender, it's going to be sore for 6 months. I'm talking a whole 6 months. It's going to bother you. You ain't going to be able to lay on that side. When you take a shower and you hit it with your hand underneath there, washing your armpits, man, it's awful. It is an awful thing to have in your body. Only between the 6 month and the year will it start getting to the point that you're not noticing it anymore, and then after a year, it's pretty well part of you. But this is the tips on it now. If you go to church or go to a family function or just see a friend that you hadn't seen in a long time, they come up to you and they run up to you and they go to grab you and hug you and put their head on your shoulder, do not let them hug you on the side that you have your device in. Make them hug you on the opposite side. Learn to turn away from them to where they will hug you on the side that you want them to hug you on. Because if their head hit this thing, and oh, will it hurt? It feels like somebody shot you in the arm for about 2 or 3 hours. So don't let anybody hug you on this side. Don't let any grandkids or your girlfriend or your husband or your wife or your boyfriend, don't let them, like you women like to lay on your arm, don't let them lay on this side. Let them lay on this side, the opposite side. Because trust me, you don't want nobody around that thing. You can't go to any loud concerts. You can't weld anymore. And you cannot have any MRIs. Now, I have a St. Jude's ICD. And I cannot have an MRI. But my mom, she has a different type of she has a pacemaker. And the type that she has, she can have MRIs. So they have new ones out there now where you can have MRIs and all. I broke my back on the railroad on the job I had as an engineer. We had a train derailment, and I had to have back surgery. And I still have a lot of complications with my back, and I could no longer have an MRI. And that really hinders them being able to deal with my back. So, that's just part of the downfall. Mine, if my battery gets low, it'll start vibrating. It'll vibrate like a cell phone vibrates. It lets you know that your battery's getting low. You have to have a new one put in about every 8 years, and once they're put in, they will not take them out, no matter what your health-wise, turns into. They're not going to take them out. And yes, they have to be turned off before you die. And if you have any type surgeries after you have this, any kind of surgeries that require them to put you to sleep or make you loopy, you have to inform the doctor, because they have to place a magnet. They'll place a magnet on it to shut it down, to cut it off when they're doing surgery. Now, because if they don't, it could electrocute them, So pacemakers or defibrillators, they'll put a magnet on. They'll put a magnet on to shut it down during the surgery. They'll send you home with a little box or a cell phone type deal. I have a box that's wireless. It connects to my machine that they download while I'm sleeping every 3 months. My mom has one. She has to set the little thing on top of her and lay there in the bed or sit there on the edge of the bed till it downloads complete. So there's different kinds of them out there. St. Jude's been real good to me about coming out, checking me and all that. If I need checking, if I go in the hospital, they'll come check it. But, you got to live with it. It's something you have to live with. Don't get depressed about it. Just live with it. Be glad you're alive, and be glad there's something they can do to help you. But mine's never went off. It's never fired on defibrillate or pace. And I'm in 3 years of heart failure. So, that's just my story. But here's my story. This is the true story of my life. I've had multiple surgeries. I've had the gallbladder took out, half a thyroid. I've had hernia surgery, knee surgery, facial reconstruction, broke noses, broke back, knee surgery. I mean, I've had a lot of them. So, it's not that I had a hard life. I just chose a hard profession on the railroad. Railroad caused me to have a derailment and broke my back. And I had to retire from the railroad a little early, but I have a great retirement. And I have been retired now almost 11 years. So I've enjoyed it at 53 years old. But 3 years ago, I was sitting here at the house and started having chest pains. I mean, I've had heart issues since 2008, since my wreck. And this is 2020. Or 2020, however how you say that. So I'm not new to heart disease. But I had a colonoscopy done. I had to get off my heart medicines like 3 days before and 3 days after. And right after I started taking my medicines back, I had a major blood clot hit my stents, which caused me to have a STEMI attack. And a STEMI heart attack is a major catastrophic heart attack. It is the worst heart attack that a person can have. It's not the Widowmaker, it's the worst. A STEMI, what I was told, 93% of the people who have a STEMI attack do not wake up from it. They die. I mean, so if you've had a STEMI attack and you live, you are very, very fortunate, because they're not a heart attack that you live from. That is a heart attack that you don't come back from. I went into the hospital, and they knew right away that I was in cardiac arrest. I went to the heart cath table. Heart cath table in there. Performed a procedure on me trying to get the clot out. They couldn't get the clot out. At that point, I think I died, and they brought me back. And the next morning, I had open heart surgery. Surgery went well. The next morning, I kicked out on them again and died again. And my cardiologist, which is Dr. Thomas Riddell at Providence Hospital, through Cardiac and Associates, is a great young doctor. He knows his stuff, and if it wasn't for him, I would be dead right now. So, he got me opened back up and got me put on what they call an impeller machine, I think, which is where they put you in a coma, and they live for you on them machines for about 7 days. Well, when I went into the hospital, I weighed about 260 pounds. When I come out of the hospital, I weighed 230. So, after 7 days in a coma, when you wake up, you don't know how to talk, you don't know how to eat, you don't know how to move your arms, you don't know how to pick nothing up, you can't walk, you don't know who anybody is. It is a devastating thing to go through. You think you've had a stroke, you don't know what's going on. So, after I learned how to walk again and all that and got stronger after about 2 weeks, I come home. And after I come home, I thought I was getting better, and I went back to the doctor and done an infraction test, and the infraction test said I was at 20, and I was in heart failure, and I probably wouldn't live very long. So, at that point, I received the ICD implant, in case I went to VTAC and my heart quit. It has never went off. The pacemakers never worked, the defibrillators never worked other than being tested, which I've never had a defibrillator tested. But my doctor assures me that I'll fall out on the ground before it goes off. The pacemaker tries to kick you in and out of, back in rhythm. Every 3 months I had an infraction level check, and for the first 6 months my infraction level was down. I mean, down. So yeah, you get depressed, you think about dying, you think about who's gonna get everything you got, who's gonna take care of your wife, you're gonna miss your grandkids, some of your kids getting married, who's gonna get all your property, your condos, your tractors, your four-wheelers, your trucks, your condos, your campers, and your boats. I mean, all that goes through your head. So don't get depressed about it. I mean, you will, but just try to look on the bright side. After that 6 months was up, I was so depressed I didn't know what to do. I mean, I tried to hide it from my family, from my wife, but I think she knew in her own little heart that there was something wrong with me. She had her own problems to deal with. I mean, because if I died, she would lose the house and lose everything, because on a school bus salary, bus driver salary, she couldn't make ends meet, and she was going to have to move and sell out and move. And because she wouldn't get my retirement until 62. So that was a hardship on my wife and my family. I had a daughter that was in the 12th grade of high school. She'd played softball all the way through school. She played softball her whole life at West Mobile Girls Softball Park. Been on numerous travel teams. Had several colleges looking at her. And her daddy had to have a massive heart attack and die in her 12th grade year, which I'm sure did not help anything with her. I can't apologize more about that, but that's just the way it is. And I put a lot of hardship on her and my wife, which I have more children, but they're grown and married. But we had all this to deal with, and I walked out. I've always been a strong man, and I had to walk out to the ball games with a walker or in a wheelchair because I wasn't able to function. And I come home one day, and my best friend come over here to see me. And I told him, I said, you know what, Andy? I said, let's put an addition on the back of the house. That's going to be my cardiac rehab. So we built a 40-foot addition on the back of my house, 12 foot off the ground. And things started looking better for me. I started getting out fishing and hunting. You got to occupy your mind. You can't just sit there and let your mind think about dying. So I started going back to the doctor after 6 months, and every 3 months I was having an infraction level check. Now, I happened to go back after we put the addition on, and I was at 35%. It's like, wow, I come up a whole 14%. My doctor said, well, that's great, but that's probably about as good as it's going to get. Well, I went back the next time, and I was at 40. I went back the next 3 months, I was at 45. I have not went back since because I don't want to get my feelings hurt if it dropped. So I'm at 45%, and my doctor said, hey, this is a miracle. You're in heart failure remission right now. So don't give up. Never give up. Charge on. Charge on with your life like nothing ever happened. I have conquered a four-wheeler wreck, a train wreck, a massive heart attack that I shouldn't even be here with. And I'm still here, y'all. I am still kicking. So don't give up. Don't let the pacemaker, defibrillator, heart failure, heart attack, don't let anything get you down. Believe in God. Believe in your family. Keep all your family close to you. And things will be better off. But I did get to live to see my daughter play college softball. She's a great athlete. She made it in the newspaper a bunch of times. And I mean, she's just a great kid. And I got her through college, and now she's doing her thing. And I hope to live a long time, at least 20 more years. But my wife, let me tell you about my wife before I go. My wife thought about her being left here alone by herself in this big old house on all this property with all this stuff. So she decided to do something about it. She'd been driving a school bus for years. So she went back to college at 53 years old. 53. For those of y'all out there who say, there ain't no jobs, I can't find one, I can't do no better. She went back to school at 53 years old and become a nurse. That's right, a nurse. When she got out of school, she put in several applications for hospitals and medical facilities and nursing homes. And she got interviews out to Yin Yang. And she was hired by Mobile Infirmary Hospital on LTAC floor. And she was also hired at SAD's Hospice Care, where she's going to work there a little bit, making bukus of money. Has started a career at 53 years old. There's no reason anyone ought to be on welfare or food stamps in this country. There's no reason for it. With that being said, I'm extremely proud of my wife and daughter and all my children. I'm extremely proud of myself. So never give up, y'all. This is my story, and I hope that it motivates somebody. And I told you the truth about what to expect with the defibrillator and the pacemaker being put in. So, y'all get out, enjoy life, take a kid fishing or hunting, take him to play golf, to play tennis, get out and do something with your children if you still got them. If you don't, do something with your grandchildren. And the grandchildren is the reason I'm making these videos, where they'll know who Pawpaw was on my websites and on my YouTube channel. They'll know who I am, or they will never forget me. So until the next time, Grandpa Cotton, gone.